That's right. It's time now for our twice weekly In Focus Health Update. Health reporter Lino Mudu joins us with some recent developments on the immunization front. Hello, Lino.
Hello, Vincent. Hello, everyone. Over the years, vaccinations have prevented death, illnesses, and outbreaks of various diseases, but some people still worry about potential risks that may be associated with having themselves or their children vaccinated. A new study reveals that fear or complacency about vaccinations can allow preventable diseases such as polio and measles to spread. The study, published in the PLOS Computational Biology, a peer-reviewed journal published monthly by the Public Library of Science, shows how to predict ways in which population vaccinating behavior might unfold during a vaccine scare. Professor Chris Bosch of the University of Utah, one of the researchers, says these findings might help in evaluating and developing global immunization programs and public health policy. The scientists say preventing vaccine scares should be part of an overall global immunization policy. Ghana is preparing to host the first simultaneous rollout of pneumococcal and rotavirus vaccines. The country will become the first to roll out both vaccines at the same time in any Gavi-supported country. Gavi is a public-private partnership focused on increasing access to immunization in poor countries. I recently spoke with Dr. Mercy Ahun of the Gavi Alliance. She explained why it is so important to vaccinate children and Ghana's upcoming immunization launch.
Well, vaccination is one of the most cost-effective public health interventions. By vaccinating children, they are protected from the childhood diseases. It has been shown that their cognitive abilities is high. They are able to attend school. So when you are talking about MDG 1, they have access to education. Their poverty level is likely to be lower because they are exposed to education. The health of the child, they have chances of living longer and then serving their countries. And prevention is better than cure. And I always give the example of measles. The cost of the measles vaccine as against a child suffering from the disease, the time of the mother, the complications that the child is going to get, the effect on the health system of treating the complications is really massive. So there is no way that you can compare the benefits of the vaccination as compared to suffering from the disease.
Tell us about what vaccines are required for children in Ghana, in Ghana's routine immunization.
At first, we had what we call the 6 basic vaccines against diphtheria, against pertussis, which is whooping cough, against tetanus, polio, measles, and TB, which is a BCG vaccine. And then we added yellow fever vaccine in 1996. Then in 2002, with Gavi support, we added the pentavalent vaccine, which is a 5-in-1 vaccine containing the DTP vaccine I've mentioned earlier, combined with hepatitis B, which can cause liver cancer, and then also Haemophilus influenza type B, which is called Hib, and it causes pneumonia and meningitis in children under 5. So currently there are 9 vaccines, and soon in a few weeks, they are going to introduce 2 additional vaccines.
Tell us about that, the pneumococcal and rotavirus vaccine that will be introduced in April 26th.
So we have a system in Gavi where countries look at their disease burden and then they decide whether they need to introduce new vaccines. So Ghana had looked at their data. Pneumonia and diarrhea are the 2 major causes of under 5 child mortality. So Ghana decided that instead of introducing the vaccines one at a time, they want to reach the MDGs. They are not yet on track for child mortality, MDG 4. So they decided to kill 2 birds with 1 stone by introducing the 2 vaccines at the same time. So they applied to Gavi support last year. We have an independent group of experts who reviews country applications. So they review the applications and they recommended it for approval to the Gavi board. The Gavi board approved. We communicated with the country And they started their preparations and decided that in April, they were going to introduce these 2 vaccines.
So one child will receive both vaccines at the same time?
Yes,
What
at
about
6
safety?
weeks.
How do we ensure that it's safe?
The 2 vaccines have been introduced in several countries, and we know that for the pneumococcus vaccine, there have been very little reaction apart from pain at the site of injection, which leads to crying. Sometimes the child can be irritable. The rotavirus vaccine, which was introduced in the US some time ago, led to a condition we call intussusception, when the intestine folds on itself and then leads to a blockage of the intestine. So surveillance have been set up to monitor this issue because it's a serious condition. And in fact, last year, Sudan was the first country in Africa to introduce this vaccine, and they are doing serious monitoring to make sure that this particular complication does not occur. And for rotavirus vaccine, currently there is a guide that the vaccine should be given until the child is 32 weeks of age. So after 32 weeks of age, this vaccine is not given. So a system has been set up to pick up any adverse events.
Now, we've seen that over the years, vaccines have been in the middle of controversy for various reasons and in diverse communities. In your country, for example, do you come across people that are resistant to vaccinating their children?
Yes, there are some who have concerns about vaccination. One thing that Kenya and Ghana have done, which I think was really helpful, was that they did a KBP survey, which talks about the knowledge, attitudes, beliefs, and practices before the new vaccine introduction. So they got to know what are some of the issues. So in Kenya, there were issues about health, the attitude of health workers, and in Ghana, there were concerns about the pain, the initial pain that the children will experience with the injection. So the health workers are able to use the findings from this survey to design communication messages. So I think that important interaction, that we don't just go in to introduce a new product, but you find out what the target population believes and then use it to design the appropriate messages, is one way of looking at this. And then also the interaction with communities. You have to look at the traditional ways of communication. So there's gong beating, there's using the chiefs and the elders of the community and face-to-face discussion to know about the concerns of the community, and then reassurance for the community that there is no vaccine which does not have any side effects, but this can be minimized. So letting the communities know about these issues is very, very important.
Pneumonia and severe diarrhea caused by rotavirus are among the leading causes of death in children under the age of 5. Ghana is aiming to immunize 1 million children against these diseases. Back to you, Vincent.
Well, thanks a lot, Lino. Be sure to watch for Lino Mudu's informative health report every Tuesday and Thursday right here on In Focus.